Hello, lab experts. Once again, welcome to the Rock Diagnostics podcast. In today's episode, we're going to be speaking about public health and how important it is for not just everyone, but also medical laboratory scientists in particular. To discuss this subject, we have with us a medical laboratory scientist, Chelsea Osayande, and she's going to give us her take on this particular topic. How are you doing today, Chelsea?
Hi, Robertson. Thanks for having me on the show. I'm doing great. What
Thanks
about
a
you?
lot for being here today. Before we get into public health itself, tell us a little bit about you.
Okay, yeah, thank you. My name is Chelsea Osayande. I am a first class medical laboratory scientist from the University of Benin. I'm currently working as a program analyst at a public health consulting firm here in Nigeria, Abuja. Yeah, so I'm passionate about public health, biomedical sciences, and also data science. Yeah, thank
Okay.
you.
And where did this interest in public health stem from?
Okay, yeah. So from my undergraduate days, I've often noticed that medical laboratory scientists are not really visible in the global context. Yeah, so we actually lack that visibility, and most of our colleagues do not try as much as possible to be involved in increasing global impact. So transitioning to the public health space, I actually I've actually been more exposed to public health interventions, and I'm seeing different areas where medical laboratory scientists can actually play a lot of roles. So I'm working on a project in four African countries: Chad, Congo, Gambia, and Guinea. And I'm working on scaling up laboratory testing in these countries. So on my project, we have very few medical laboratory scientists. And we know that we have the knowledge and expertise in this particular area, but where our colleagues, they're nowhere to be found. Yeah. So I think we can actually try to be more involved in these areas of health generally. So that's why I wanted
Yeah.
to talk about it today.
All right. And when you're talking about, it sounds interesting, scaling medical laboratory testing, in what sense do you mean? On the technological side, on the personnel side?
Yeah, it's
what are you focusing on?
Yeah, it cuts across different work streams on the data management, biosafety, biosecurity, sample referral management, including the human resource management, policy and governance across different work streams across these different countries.
So when it comes to that, how have you already begun talking to medical laboratory scientists in the field? What's the acceptance looking like? Are they ready to change some things? Because I know that down here, for example, in Benin Republic, it's very hard to get people to get into the technological side of things, whether it's using digital databases or anything of that nature. They're used to writing things down, and so they want to keep writing things down. When you tell them to invest maybe in technology, computers, they don't really want to get into that. They're a bit scared of it. But what have you seen on the ground?
Yeah, so far so good. I'm talking to a few medical laboratory scientists and working directly with the director of lab in these countries. So they're actually open-minded. They're open-minded. I think maybe we've lacked the information or knowledge, or kind of just restricted to our own laboratory bench mindset. So when there are more things that we can actually contribute to the society and to the world at large, yeah. So you've actually had open mindset, uh, and I think that exposing this area to more scientists, including the ones that are still in school, would be helpful
Hmm.
to like just expose them to what we can actually achieve, not just working in the laboratory. That is also very good. That is also very good. I've learned a lot of laboratory skills from immunohistochemistry and all that. really, really nice laboratory skills. But then we can be more, and I think the lab is already saturated. So we
Yeah.
actually need more, yeah, scientists to like show the world what we actually do and stop hiding just behind the laboratory doors.
And I think more and more those studying medical laboratory science are seeing that, understanding that the field is saturated, but they don't necessarily know in what direction to go, and they
Yeah.
don't necessarily exactly know what to do. In your particular case, how were you able to transition? What allowed you to make the change?
Okay, well, after completing my internship at the National Hospital Abuja, so I was looking for other ways to actually explore the profession. I was not entirely sure, and I'm also looking for other ways to explore the profession currently. Yeah, so I kind of saw a post about this management consulting role as an intern. I actually joined as an intern. Yeah. So when I joined, it's field work. We have to analyze data generated from the laboratory and all that stuff. So I felt it was really quite interesting, which is different from what I've been used to. Yeah. So I I actually didn't know about this particular area before. So it was just like I stumbled upon it. Yeah, and I'm like,
Yeah.
"Yeah, okay, yeah, this is cool. Everybody should know about this." Yeah. So that's how it happened.
Okay, so like most of us stumbled into medical laboratory science. You found medical laboratory
Exactly.
scientist, and you stumbled into
Yeah.
public health also.
Yeah.
Yeah, it's true that it's something that makes quite a big, or that can make quite a big difference. Especially, I remember when we started having issues around 2020. I was surprised by the amount of medical laboratory scientists I did not see speaking up, because there was, at
Exactly.
least here, there was no one from the medical laboratory science field really trying to go forward and share their experience. They were sort of waiting for decisions to be made, say at the WHO level, and then for things to trickle back down before they made any sort of decision, which made it such that the problems had reached such a level that it was more complex to take care of them than if they had tried to share a bit more about what is already known about, or what was known about past pandemics, past issues. And I think it would have also helped to calm down the population if there are more medical laboratory scientists willing to come forward and explain what they knew about the whole process. But in that vein, what do you think could be the role of medical laboratory scientists in such instances?
In such instances, like educating the public on recent pandemics or recent disease outbreak. The irony of everything is that we are the one that actually have the first-hand information. We are the one that actually see these microorganisms under the microscope. So I think we're even in the best position to explain this. And it's not bad for us to come out there and say, hey everyone, this is how this disease or this outbreak is going, and even generate insights on how on the trends. Like once you have enough data to back up your analysis, you'll be like, okay, we see this increasing in the next 2 day, in the next 2 months, or if we have this preventive measures, this will help us to mitigate the risk of this infection spreading out. So if we actually come out and say these facts, it can be the laboratory head, or just basically anyone can do that. But I think we're scared, or we don't have enough confidence to do that, and we're like, we just want to be confidential about what we're doing. But that's not confidentiality. Confidentiality is another different ball game. That's not the confidentiality, trying to educate the public on these things. So what we just decide to do is that, okay, fine, we'll generate this data, we'll make the decisions, then hand it over to the doctors, or hand it over to the epidemiologists to provide these insights, which should not actually be so. We can't actually say that, yes, we've conducted this analysis, and people are going to see that confidence that, yes, we actually did this, because once you are the one that did something, you'll be able to speak with confidence. Like, we analyzed this sample, or we have analyzed 500 samples, and we noticed this. You can even have like a knowledge sharing platform where this knowledge can be disseminated firsthand. So that's something that I look forward to, in Nigeria and also other countries.
Yeah, I think you hit the nail on the head when you said scared, because that's the direction in which I wanted to go. But I think people are sort of scared that if they go forward and then they make a mistake, or what they say is wrong, it might be held against them. But in that kind of situation, since you are the first line of defense in many cases, at least among those in the first line of defense in many cases, I feel like it's really important to share what it is that you know. And one problem is sometimes medical laboratory scientists don't want to go forward and put themselves there to speak up, but then they are surprised when, say, medical doctors and others are given more respect because they have that courage to go forward and then actually speak up and actually share what it is they know. As long as we hide in our laboratories, people are never going to know about us. People are never really going to respect what we say as much because they don't see us, they don't know us, they don't know what we do. And so I
Yeah.
think that's one way in which also it's important for more of us to go out there and actually talk and express ourselves and explain what it is that we know how to do. Then also going in this same direction in the preparedness sector, when it comes to, say, vaccine development and testing, is there any way that medical laboratory scientists could be involved in that? Let's say there are some people who are watching this who maybe are interested in getting involved in that aspect of things. Is there any way for medical laboratory scientists to be involved?
Yeah, of course. Vaccine production is a very big sector that medical laboratory scientists should venture in. So we have developing monoclonal antibodies. Medical laboratory scientists are very much involved in this aspect. You can also specialize in biotechnology, where these production actually take place and be actively involved. So vaccine production, of course, sure. In fact, we are much needed in that area as well. And also testing the virulence of these vaccines. Are they safe to be used? Conduct like, you culture these vaccines to be sure that they are not virulent, they are not going to be harmful to the end users and all that. So medical laboratory scientists should be part of the vaccine production process.
Yeah, it's something that we need to spend a bit more time on. Now, I'm sure in your work you have to be in contact with lots of healthcare professionals.
Yeah, across all sectors, yes.
All right. How do you usually manage communications with them? How easy or hard is it? Let's say you're going towards them and, how do I put it? There is work that needs to be done. Do you have different approaches, say, going from one professional to the other? I'm asking because, of course, as medical laboratory scientists, we have to deal with health professionals in various capacities, whether it's doctors, it's nurses, it's people who are more on the public health side. Have you seen that there's a different way of communicating with those different groups, or does the same method usually apply?
Yeah, I think it depends on your rapport with these individuals. So I don't really see a problem going forward, going up to meet someone and say, okay, yeah, this is where we are in our implementation process. What are your insights? What can you advise? Or if we actually need their help in those areas. So it just depends on your mindset. I don't think there should be any limiting obstacle to communicating with them. So one thing about building visibility is to build partnership as well. So once you continue partnering with different professions, it also increases your visibility as a profession. So there are things that we cannot do everything on our own. And if we're doing things on our own, of which we are doing as medical laboratory scientists, we will remain unseen. So the best way to let people know about what we do is for us to partner and collaborate with other people, to be in the front row, front line with those people. And so, yeah, by doing such, we're going to be increasing our visibility in the public health. So there is no limitation to communicating with anybody across any profession.
Yeah, because I know, for example, a medical laboratory scientist that I know, I'm sure he has a lot of experience in the field, someone who works a lot. And I know that in some cases, actually, in many cases, doctors tend to call him to confirm diagnosis because they know that he's so well read and he knows so much about the field. But I feel in some cases, the fact that we don't show what we can do makes it so that the doctors in sometimes feel like they can't come to us with problems when in actuality it's likely that we could help with in one way or in the other. I also know some people who say they have issues communicating with, especially when they're younger, communicating with, let's say, doctors or other individuals who are a bit older. They don't necessarily, how do I put that? Take them as seriously. So on that side, have you ever stumbled on anything of that nature, or is it usually easy?
Yes, so I get that point, I get that angle. Yes, it happens a lot. So if you're an intern, you can't walk up to a consultant and say, hey, this is what I did, or this is what I. That's not the right line of communication. You understand? So let's not misinterpret it. That's not the right line of communication at all.
Mm,
Um, uh, Knowing that in African countries, we actually respect hierarchy, very like we take it into consideration. So you can't do that. So the advice, of which I was also advised, is for you to take your findings to a much more senior colleague and explain it to them that this is what I got or this is what I found out. How do we relate this to the doctors? How do we relate this to the pharmacist to make sure that the patient is okay? Yeah, then the senior colleague will also go and meet the doctor and say, hey, this is what we got. My colleague and I found this out. So it's better for the patient to take these routes rather than the route that the patient is already taking. So that's the best line of communication, not just
yeah,
going from an intern or a junior, very junior staff to a consultant. It feels like you're insulting the consultant that he doesn't know what you are doing, that he doesn't know what he's doing. So it's
yeah.
better to like relate that to a much higher colleague in your profession to relate that information. So that information is
Mm.
better communicated across and your message will be heard. Yeah.
So it seems it applies to multiple fields because one of the things I also do is I work with universities in various sectors. Now, one thing I've realized is when you're going towards, let's say, a department, usually the best way to be able to share information is to find the head of the department and then convince the head of the department. And then what they simply do is tell their colleagues what needs to happen, and then it happens. But then
Yeah.
when you want to go one by one, usually you'll get to a point where you reach a roadblock. And then usually that's going to make things much harder to get it, make things much harder, make it much harder for you to get to your final destination. While when you go from the top, then it simplifies things all along the way.
Yeah. It does a
So
lot.
you're saying it's similar also in the healthcare sector.
Yeah, so it's similar across all sectors. So you have to know your place and how just do things in a respectful way so you don't
Yeah,
land in trouble.
true. True. So medical laboratory scientists can try and help in the public health sector. You said when you started as an intern, you started a bit
Yeah.
more on the data analysis side. Was that it? Did I get that
Yeah.
right?
Yes. So you'd conduct more of data analysis, developing implementation plans that will be reviewed by your senior colleagues, and also just generally getting insights into the profession.
Yeah. So some of those who listen to the podcast, watch the podcast, are current students. Some of them are also thinking about various ways they can branch out from the medical laboratory science field. Some who are looking into data analysis might be interested in that aspect, so I want to spend a bit of time on that. What are some of the skills? What are some of the things they may want to learn if they want to branch into data analysis?
Oh, yeah, thank you. That's a very good question because for me, I was able to go into that role because I had gained some skills while being an undergraduate. So I'd learned how to use Excel, I've learned how to use PowerPoint, I'm currently learning how to use Python and Power BI. So those skills should be like were an added advantage for me. So getting to that role wasn't so difficult because that's like our everyday job. You understand using those softwares. So if you want to branch into that field, data analytics, you should start learning how to use those software. So if you can't use Excel, start learning how to use Excel. Sign up on Coursera, Udemy. There are different platforms. Even on YouTube, you can get to learn the skills on YouTube. So just try to get these skills on time and practice so that when you're needed, you will not be so new to the game. You'll be able to adjust quickly as possible. Yeah. So that's
Yeah.
like the basics.
So you mean we shouldn't be running away from Excel? I know a bunch of people who, when they hear Excel, they run in the other direction.
No, no. So I'll also encourage students to you're studying medical laboratory sciences. You're studying medical laboratory science. Well, you need to pick up other skills as well. You understand? During the
Yeah.
holidays, you can read your books and also pick up one or two skills. Like for example, I learned how to do graphic design during the lockdown. Like just pick up some skills. You may not know when you are going to need them, so don't just like focus on graduating with just one degree. Graduate with a degree and also other skills as well.
Yeah.
So it makes life easy for
Yeah.
you when you graduate.
Yeah. And also when, if at some point there's, for one reason or another, you can't do one thing, there's something else that you could fall back on.
Exactly.
I mean, even as a graphic designer, if let's say you're working for companies in healthcare, they'll be more likely to want to get someone who already has the background in healthcare and is also a designer than just a random designer.
Yeah,
So it's
that's true.
always important. Yeah. So what's a day, let's say a day in your life when you go to work? What's the day like? What do you do?
Okay. Yeah, so a day in my life, I'd go work, wake up in the morning, go to the office, check my deliverables that I have for the day. What task do I have to do? Do I have to? It just depends on my work plan. So I work according to my work plan because we're trying
Yeah.
to implement different interventions. So you need to have a work plan. So you're going to check. So this is what I have to do today. Or for example, I'm developing a monitoring and evaluation framework. So I was like, okay, where did I stop? Have I identified my indicators? Just like that. So have I developed the data collection tools? If that's what I have to do today, then I just get on it, do more research, start developing those tools, then review it with my colleagues and all that. So it's usually a bit stressful. It's usually a bit stressful because you have to do a lot of thinking, unlike following a SOP to just do laboratory
Yeah.
testings and all that. So it's quite a bit stressful, but it's quite enjoyable as well. Why we get on it. So
So
it's
it
like a
varies.
24 hour.
Depends on what really you have to do on the day.
Yes, so it varies. Depends on what you have to do. And I think like you're working 24 hours in your head because even while you are sleeping, you are like, ah, don't you think I can do this better? Don't you think I can use this other approach? So yeah, it's a continuous process. You
Are
don't
you
have
trying
to
to tell
stop
us you also
essence.
dream about work?
So everybody dreams about work. Even while I was
Uh,
working in the lab, I sometimes I dream about work. I dream about collecting patient sample at the blood bank.
yes, that's one. That happens.
Yeah.
Now, when I hear monitoring and evaluation framework, that means also there is some project management in there. Did you have to learn, get some special certificates, or did you learn on the job? How did that happen?
Yeah, so it's more like learning on the job. But for me, I'm very keen on personal development. So I've also gone to like explore these courses online. So I've taken several courses on project management. So while I'm learning on the job, I'm learning on my own so that I'll like have maximum input on the job. So just monitoring and evaluation is very useful in measuring the impact of your project. So if you're implementing something and you're not monitoring that project, you don't have a clear direction. You don't know what you've achieved in quantifiable numbers, and you cannot relate the impact of your project to the general public. So
Yeah,
we're trying to, for example, you are training 20 laboratory personnel on biosafety and biosecurity, and you did not take a pre-assessment on the knowledge gap. You did not take a post-assessment. How are you going to measure this? How are you going to measure the impact of your training? So you're not going
yeah.
to, you're just going to say, we trained 20 personnel on biosafety, biosecurity. How did this impact laboratory testing? How did it impact reducing infections in the lab? So you also have to monitor your project or whatever you're implementing.
So you need to check and you need to make sure that what you are actually trying to do is having a positive impact, is having an effect. Or even if it's
Yeah,
negative, you still need to know so that you know not to do that again and again
exactly.
in the future. Yeah,
Exactly. Yeah.
something sometimes we miss, but that's extremely important. So, in your work, have you seen what's the, in general, what's the impact that incorporating new technologies has on, let's say, various laboratories with which you worked? Like, if you were to, I don't know, give it a percent increase, let's say, in efficiency, how much would you say it helps? I mean, it depends on what technologies you've worked on in the past, sure, but according to you,
Yeah, yeah, thank you. So, the world is heading towards technological advancements every day. So, the lab is not out of context in this context. So, I would give an example. For example, in Chad, we're trying to digitalize the data management system
oops,
across the laboratory network. So, yeah, so we've been able to uh, use laboratory information management system. We're trying to implement that in those laboratories. Then, I mean,
go on.
so most of these lab use the normal paper based data management system. So we've been able to access these laboratories and see that we can actually improve the laboratory process by implementing a laboratory information management system software in those labs. So from this intervention, we've been able to see that they will be able to upload laboratory generated data to DHIS2, which can be used to make informed decision, knowing disease trends, early detection of diseases as well.
Is there anything? particularly important that you wanted to spend more time on?
but we have of role in contributing to technological advancements in the laboratory. Like I had earlier mentioned that I'm also passionate about data science, and we generate a lot of data in the laboratories that are not being utilized
Yeah,
completely. So we do not maximally utilize the data that we generate, and that's one aspect that should also be looked into. We should be able to um, get this data. We can even explore mechanisms like machine learning, AI development to just improve our testing accuracy and all that using data already generated from the lab. I know some work are
yeah,
already going on in this field, but it's something that we should also look into. It's something that more medical laboratory scientists should be involved in. Yes, so that's one area as well that I'd like to
yeah,
mention.
yeah. I think that's something that's particularly interesting. It's something that I've always wondered why we don't do more of, for example, bioinformatics, because even in countries where maybe you don't have access to the best laboratory equipment, at the very least you have access to brains and computers. And so it's work that could be done that can allow research to be done that could allow you to get funding so that eventually you could get the laboratories and you could keep moving onward and forward. And things like AI, I think, are extremely important. Like you said, we have tons of information in laboratories written in paper logbooks on shelves that could be used actually to find out a lot about our populations, about a lot about the diseases that affect us, but they're essentially locked out of the system because it's not digital, because there aren't people who are actually looking for it yet. The medical laboratory scientists are not using it yet. I think it's partly because many of our labs are commercial in nature, so the academic part isn't something they're that interested in. But I think if we're able to show them that even commercially there's some sense in doing that, we would be able to bring along even the commercial labs to engage a bit more in mining their own data to help determine what are the most prevalent issues with people in the population around them, because even
Yeah,
that has commercial value, because it allows you to
exactly.
know, okay, every year what's the amount of this or that reagent I'm supposed to get, what do people suffer most from, do I need specific partnerships to be built with this or that other laboratory because they have this service that my people need that I don't have. And so I think if we can explain it to commercial labs in that nature, it's going to allow them to do that research, which is also going to help on the academic side. I think all that it really requires is just more, not more, I would say better communication.
Yeah, better communication, collaboration, partnership, improved learning, and more exposure.
Yeah. Now, for someone who is listening to this and who wants to engage in public health, in your case, you started with an internship. I usually tell people, yes, the internship is extremely important. I don't know why people run away from those. Usually, in some cases, they run away from those because they aren't always paid. But the way I see it is, even when they aren't paid, you are learning a lot. And in many cases, you are learning whether this is actually a field you want to be engaged in. Because in some situations, you think that's what you want to do. And it's when you start doing the actual work of it, you realize, okay, this doesn't fit with me. And then you have to go and look for something else. If you do internships right then and there, you have a very good idea of what happens in the everyday, day to day goings on, and whether that's something that fits with you, whether it's something that you are comfortable doing. But aside from the internships, actually, let's even focus a bit more on the internship aspect. What would you advise someone who, let's say, is still studying right now or who just finished studying, who's looking for an internship? How would you advise they go about it? Towards what sorts of organizations should they be heading to? and what should they be putting forward to increase their chances of being kept, of being brought in to help work on projects that have to do a bit more with the public health side of things.
Yeah, so first of all, you know that we have to complete our compulsory internship at a government hospital or facility. Yeah, that's compulsory. So people are really they are really not encouraged going on to do another internship after completing the first internship that is compulsory. Yeah.
Yeah,
So I would advise that maybe during the NYSC program, after your first internship, during the NYSC program, I think that's a easier route, but I think that's Nigerian specific now. During the NYSC program, you can apply to public health firms. You can do that on the Google search or Indeed or even LinkedIn. You can find these companies, public health or consulting roles that are involved in public health as well. So you can do that search, just try to get a number of those that you can apply to. There are more of them in Abuja here. So you can just apply. It's easier to get in through the NYC route so than applying after graduating or after completing your NYSC. So
yeah,
that's what I would advise. Just put in your applications that you want to be a graduate intern in those places. So you're both doing your NYSC and also being an intern in those organizations. So that's the route I actually used as well. So it's kind of like a win-win. Yeah.
yeah,
So, but if you're not in that position, you can also apply as a graduate intern if you are keen on getting that experience. So, companies that have website link to the application, you can just like follow up with the application, send in your CV, and if you're good enough or you can learn on the job, then that's fine. Because as an intern, we don't expect you to have so many experiences. I expect you to come like almost as a clean slate, like
yeah.
not even knowing so much about the profession. Yeah, so it's easier to do that than getting a job as a program analyst or as an associate in the public health field. Yeah. And it's also
All right.
good to start on time, start early as soon as possible. If you know this is what you actually want to do, then why not?
Sure. So thanks a lot for taking the time to share all of this with us here today. I'm sure those who listened actually learned a lot about what they can do outside of medical laboratory science or in addition to the medical laboratory science, either while they're still students or once they are done. And thanks a lot for taking the time to share all that with us here today.
Thank you so much, Robert. It's nice having me here.
Thank you. So, medical laboratory scientists, you heard that it's important to try and branch out, like we usually say. One way in which you can branch out is by being more involved in the realm of public health. As you all know, as we all saw in 2020, not that long ago, it's an extremely important field in which to get involved. It's also important for you to learn to speak a little bit more in public because it's going to help you. It's going to help your career. It's also going to help those around you. And it's going to help the profession as a whole. Thanks a lot for taking the time to be here with us today. And hopefully we see you next time to talk more MedLab. Thank you. Bye bye.
Yeah, thank you. Bye, guys. Bye, Robert.